This is a presentation on substance use for the iReach program. First, a quick acknowledgement that this project was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, and a disclaimer that the contents of this presentation and myself do not necessarily represent the official views of, nor an endorsement by, HRSA, HHS, the Department of Veterans Affairs, or the U.S. government. For this presentation on substance use, there are 3 learning objectives. So hopefully by the end of this presentation, you'll be able to first identify the signs and symptoms of substance use disorder. Second, you'll be able to know the risk factors or be aware of the risk factors for problems with substance use or substance use disorder. And third, be aware of the treatment options for problems or struggles with substance use. So first, let's review the signs and symptoms of substance use disorder. In terms of what a substance use disorder is, it's sometimes referred to as an addiction by other folks, but just in the mental health field, we consider this a mental health disorder that causes people to experience significant difficulties with controlling their use of substances. And it's important to point out here that this is not something that's considered to be a lack of willpower or not trying hard enough in terms of trying to reduce use of a given substance. This is considered a disorder, a mental health condition that is linked with chemical dependencies and things going on within someone's brain that actually make it really, really, really hard to control their substance use. So there are several different signs and symptoms that are linked with that. First being increased urge to use drugs, so noticing cravings or urges to use drugs that increase over time, inability to stop, despite maybe awareness that one should stop or even a desire to stop, but being unable to do so, using drugs in hazardous or dangerous situations, experiencing some kind of changes in relationships with those ones around you, loved ones, close ones around you because of your drug use. Feeling depressed and anxious is often occurs around difficulties with substance use. And then there's also withdrawal symptoms or feeling really sick when you stop using drugs. Or any given substance. So if there's a reduction in substance use or unable to access those substances and you start to experience withdrawal symptoms or feel really sick, that's a key factor that we associate with substance use disorder. And then increased tolerance. We talked just a second ago about increased urges, but there's also increased tolerance where over time noticing the desire or need to use more substances than previously or increase the dose of the substance to achieve the same effect that you may have experienced in the past. Next, we'll talk about risk factors for problems with substance use or substance use disorder. And it's important to review these because oftentimes when someone is experiencing significant difficulties controlling their substance use, it's not something that comes out of the blue. There's often either situations or stressors that may be contributing to that significantly, or maybe even have led to the development of that issue. And so it's important to be aware of the various risk factors that can go into substance use disorder or difficulties with substance use. So first, family history of problems with substance use. If you know that within your family other people have struggled with substances or alcohol in the past, that automatically is a risk factor for you potentially experiencing something similar. There's a genetic component to this that can be passed down within families. So that is a risk factor. Unfortunately for veterans, a lot of the experiences that many veterans who serve are in themselves risk factors. So deployment, being deployed or being exposed to combat, those are risk factors for developing substance use disorder. Having an existing mental health disorder or another mental health disorder that someone is struggling with is also a risk factor. So suffering from depression or experiencing chronic pain, those things can sometimes lead to the development or the dependence or use of substances to cope with the stress that is involved with depression, or cope with the stress of chronic pain. With chronic pain specifically, that might even lead to overdependence of opioids and development of problems with using that, or an addiction, as someone might say, to that substance over time. So co-occurring mental health disorders is another big one. Trauma exposure is also a big risk factor, and we know that PTSD and substance use disorder are they're commonly found together. They're highly comorbid, is what we would say. And unfortunately, those two things really feed off of each other. So it's not uncommon for someone to use substances to cope with PTSD symptoms of reliving the experience, or having difficulties forgetting, or encountering frequent reminders, or being on edge all the time. People can use substances to cope with those really, really difficult symptoms, but unfortunately that leads to greater use of substances in the future, and it even maintains those PTSD symptoms over time. And so that's a very vicious cycle that is commonly seen, unfortunately. There's also combat-related physical injuries, not just mental health injuries. That's a risk factor for problematic substance use in the future. And then challenges with transition to civilian life. For veterans who are deployed, come back, transition from military to civilian life, and if that's not a smooth transition and you encounter a lot of stressors, which is very common, that can also be a risk factor for problematic substance use. So even though there are many risk factors that are common across all veterans that can lead to substance use or substance use disorder, fortunately there are a lot of treatment options available as well. First, at the top, there are a couple things that you can use just to cope with problems with substance use or a substance use disorder without necessarily engaging in full-blown treatment. So there is a national SAMHSA helpline that you could call, and they can help you get connected to support groups and community-based organizations, as well as treatment facilities in your area if you decide you want to start pursuing treatment. Maybe even outside the VA if you're interested in seeking treatment for substance use that isn't at a VA clinic. So that's one resource that you can use. And then additionally, Make the Connection is a website that features a whole wide range of testimonials from veterans who have undergone various stressors and challenges and overcome a lot of difficulties in their life and demonstrated adversity. And there are many testimonials that are related to substance use and recovery specifically on that website. So you can go to Make the Connection and look at some different videos of veterans talking about their path to recovery and how they got there and what resources they used, if you're looking for maybe some insight to what other veterans have done or some inspiration with how other veterans have handled this problem. Then in terms of treatment and actually seeking treatment, you can first just call your VA provider and schedule a mental health appointment. You can get connected with a VA clinic, and they will offer a whole wide range of treatments and talk therapies. Some of the ones that you might hear about or see are things called motivational interviewing, which is really designed to help you identify what motivates you, what reasons do you have for reducing your substance use or cutting back or quitting entirely, if that's what you decide you want to do, and how can you use that motivation or use your own personal resources and values and what's important to you to achieve those goals, rather than having someone tell you what you should do necessarily or scold you for certain behaviors. Motivational interviewing is really designed to help identify your own reasons for change, and that can be extremely effective and helpful for substance use disorders. Then there's also CBT for substance use disorder, which is cognitive behavioral therapy, and that can be done with a therapist that helps you identify the thoughts related to substance use, maybe thoughts that might lead you to use substances or increase the likelihood that you're going to use in a given situation, behaviors that are associated with your substance use, in addition to emotions that might play a role in using substances to cope or to avoid different things. So CBT is a very well-known therapeutic approach, and that is also available for substance use specifically. The other thing to point out is that VA clinics have also a lot of different formats for substance use treatment. So there are, at the high level, there's residential substance use treatment where you might stay overnight at a VA facility, or like in housing is what I really mean. Housing like outside of a VA facility, but then stay within this residential program for a couple weeks or a month or something like that. If for some folks who need to kind of get away and focus on this exclusively for a period of time. But also, if you can't do that, if you can't commit an entire month to working on treatment, you could also do intensive outpatient, where you go to a VA and see somebody, for weekly sessions. They also have options for group-based treatment versus individual-based treatment. And there are self-care groups where, you can meet with other veterans and peer counselors to either just talk about your experiences and maybe support each other as you're pursuing recovery, and also while you're maybe maintaining recovery. If you've been successful in cutting down or reducing in the past and you're just trying to maintain that progress, there are self-care groups that are available for that. And then lastly, there's also medication treatment that's available for tobacco use, alcohol use, opioid use. And in some cases, when you talk to your VA provider about your specific concerns, they may even recommend, combining medication treatment and talk therapy, and doing both at the same time. And in certain cases, that can be a helpful or good approach to take depending on your situation. So there are a lot of options available out there. Thank you very much for listening to this presentation. Please feel free to check out all the other presentations and modules of the iReach program along with the fact sheets. There is one fact sheet linked with each presentation, which also includes additional resources and suggestions. Thank you again.